Musculoskeletal Institute is probably one of the most advanced buildings, state-of-the-art buildings that you'll actually see in the country. We went and we asked all the clinicians, we asked the researchers, and we asked our administrators and even patients what they wanted in a building.
It is a dream. This is a once-in-a-lifetime opportunity to be part of building a building like this.
You need state-of-the-art facility to do research. You also need that kind of facility to be able to attract the best talent there is out there.
We have the Emory Orthopedic and Spine Center, as well as our Ambulatory Surgery Center. We have our Emory Physical Therapy, as well as Emory Imaging.
The key to designing the perfect building is really to get input from everyone who's going to occupy it. Physicians, nurses, support staff, patients, even the people that help clean and maintain the building in the evening.
And this building really is at the forefront of both clinical care and research. And I think that actually will parlay into recruiting some of the best and brightest clinicians, surgeons, and researchers around the country.
So this is a central registration area for patients that are being seen by any of the physicians in the building. And then past this is advanced imaging, MRI and CT registration, and just past that is physical therapy.
Our patients come in with wheelchairs and crutches and stretchers and walkers. So when you walk through the building, you'll notice the transitions are very smooth for them to minimize any tripping or falling.
The minute you come off the elevator and enter the waiting room, it's spacious, it's peaceful.
After a patient registers on the main floor, they'll come up to their assigned floor and they'll be told to wait outside one of the clinical lanes, which are letters A, B, C, D, and E. If they need to get an x-ray first, then they'll come over here and they'll go down this hall to get their x-ray. Otherwise, they can go right to their assigned clinical area. So once it's time to go back to an exam room, the first stop is in one of these intake alcoves, and that's where height, weight, and other vital signs and medication verification is done. And then the patient will be escorted back to their assigned clinical exam room.
The layout of our building also allows for the support staff to be in closer proximity with the providers that are treating patients.
After the patient visit with the physician or the provider, and before getting on the elevator, they're going to stop here at this desk and either schedule follow-up appointments or diagnostic testing, and then they'll go down the elevator and exit the building. Our elevators use something called destination control, and what that means is that everyone selects the floor they're going to, and I'll select the floor here, and then it tells me which elevator is going to be the car that I'm going to be traveling in.
We have a state-of-the-art imaging center. We have 2 brand new 1.5 MRIs. We have 2 brand new ultrasound machines that we use for diagnostic and procedures. We have a C-arm, and we have a dual energy CT.
This is one of our digital x-ray suites. We have 8 of them in the building now, and it can expand to 10.
Welcome to our newest facility at the MSK building.
Most people that walk through these doors are not going to need surgery. They're going to need rehabilitation, and we did a lot of planning on the design of the space as well as the layout of equipment. You can see we have our Pilates equipment. We also have our certified hand therapists that have the most up-to-date equipment at our tables over there.
So this is the Ambulatory Surgery Center check-in desk. Patients check in here. Their families are able to wait in this comfortable area, taking advantage of the large atrium and the outdoor lighting and views.
We are very lucky to have one of the most up-to-date ambulatory surgery centers here in this building. You'll notice that each room is exceedingly large to allow us to have some of the most up-to-date technology.
So this is a typical outpatient orthopedic ambulatory surgery room, and we have all the state-of-the-art equipment to do all kinds of outpatient surgery, ranging from arthroscopic surgery, looking with cameras into small joints, ligament repairs or replacements, hand and foot surgery, and probably about 70% of orthopedic surgery can be done in a facility just like this.
Our operating rooms are disinfected with UV lights to ensure that infection prevention is always a focus.
We have some of the most up-to-date AV electronics that allows us to broadcast the surgeries to almost any video apparatus here within the building, as well as our conference rooms on the 6th floor.
So this is one of our spinal injection and procedure rooms where we use fluoroscopic guidance to make sure that our injections are at exactly the correct level for the patient's pain and problem. And we do a lot of pain injections, over 8,000 per year, and even more upcoming in this facility. So this is the main core research facility in the Emory Musculoskeletal Research Center.
We designed this laboratory with the perspective that we're going to do research that will be useful to our patients.
This is our biomechanical testing facility, and we have several machines like this one that can test the mechanical strength and stiffness of tissues that we're regenerating, whether it's bone or cartilage or tendons.
To be able to use a space like this for the next generation of scientists and clinician scientists is, to me, the best thing that we could think of, and it's also the most exciting.
In order to build a world-class research program, there's really three key components that you need to have. The first is a state-of-the-art research facility, and clearly with the opening of this building, we now have that. The second is talented people in the area of orthopedic research, and we have that, but this facility is going to enable us to recruit more talented people and to keep them engaged in here. And then the third part, which isn't as easy, is having all of that closely tied to the clinicians and the patients so that the research that you're doing is relevant to the actual problems that we're seeing today in patients. When you can put all three of those things together, like we have in this facility, that's a game changer.
It is absolutely incredible to be in a building such as the Emory Musculoskeletal Institute to both treat patients as well as be on the forefront of research.